It will take a few seconds. Okay, you might begin.
Okay, then I could start. Good day and a warm welcome to all and to the two presenters. I would like to introduce myself briefly. My name is Eva Brinkschulte, and I'm the head of the Institute of History and Ethics of Medicine at the Medical Faculty of Otto von Guericke Universität Magdeburg. The topic of this section, the 8th section, is abortion cultures. We will first listen to the two lectures and then we have time for the discussion of both papers. As you all know, you have the possibility to ask questions in the chat, which we can then include in the discussion. I would like to introduce our first speaker, Bartosz Ogórek. He is assistant professor at the Institute of History and Archival Research of the Pedagogical University of Kraków. His main research interests are demography and fertility. He will talk about today the abortion culture in interwar Poland. Please, you can start with the talk. Are you ready? Then let's start.
Thank you. Thank you very much for this introduction. I will share my presentation. I hope it's visible. So let me start by drawing some context and motivations for my study of abortion in interwar Poland. First of all, we have to be aware that during that time, many populations encounter global process of and universal process of fertility transition. So it is the case of Poland at the turn of the century. Average woman on Polish lands gave birth to approximately 6 children, while 30 years later, this number is only 3.5. So the fertility rate dropped almost by half in the short period of 30 years. So it raises questions, how did that happen? By what means this reduction was achieved? And when we look at what is known by demographers, they propose the model summarized here by this graph or by this plot. This shows that as the population goes from the high fertility to low fertility, we see first the upsurge in the induced abortion as the main mean of fertility. And
could you please mute your microphones so the audience, because we hear some noises. Okay, thank you.
Thank you. And the contraception plays minor role in the process at the beginning, and later on this situation reverses, and low fertility modernized societies refer less to the induced abortion and use a lot of effective contraception. But not all of the countries followed this path, and for these countries that even though the fertility was already low, kept on referring to the induced abortion, demographers coined the term abortion culture. So this mainly concerns the Central Eastern Europe communities, societies that experienced period of state socialism or communism, and is characterized by some distinct characteristics like extremely high abortion rates. And induced abortion is used in this kind of populations, societies, not as the last resort when the contraceptives failed. It's rather used as equivalent or one of the equivalent means of fertility limitation and birth control. So this causes also peculiar educational gradient, so that the more educated women also have higher abortion rates than lower educated ones. And I wanted to look at the abortion in the interwar period and see if there is some relation to this abortion culture. Can it be prescribed mainly to the heritage of communism, or maybe we can see some elements of this already in the interwar period. Of course, the topic is not easy to research because of the silence of the sources, the criminalization, illegality of abortion in the interwar Poland, as well as the social costs, high social costs of abortion. Questions of intimacy and taboo prevented people expressing freely about their experience of birth control and induced abortion. And also we encounter the problem of discourse bias. So we have a lot of information from journalists, writers, politicians of that time, but I have the impression that they were all interested in exaggerating the scale of a problem for very different reasons. Finally, I would like to remember and look at the human experience. So how these models are reflected in the behavior of individuals. So I have stated the main research question related to the abortion culture, but it's of course also related to some sub-questions. So how prevalent was abortion during that time? How it was related to the use of contraceptives? Are there any gradients, socioeconomic, educational, among the abortion seekers? And what were the other determinants of abortion on an individual level? Finally, what is the role of gender power relations within the couple household regarding the abortion decisions? So I refer here to two levels of analysis: macro level, where I use the aggregated data from Central Statistical Office and use mortality method to project, to estimate the incidence of abortion in that society, and micro level, where I use family size survey run by Polish Institute for Population Research in the 1930s. I have gathered 510 questionnaires that you can see here, that is describing this demographic socioeconomic situation of a couple, number of children, previous generation data, and the data on used contraception, on number of spontaneous abortion, induced abortion, and some remarks usually regarding the potential reasons of this situation. So going first to the macro analysis, I would like to start with the showing what is named the abortion culture in the Polish People Republic from 1950s to 1970s. This is important because you can see here this line that is showing us the amount of legal abortion, the official figure of the legal abortion, and we can see immediately that even though abortion from 1956 was legal, it is not complete picture. So some researchers show that in fact the abortion in the socialist period was much higher, but due to the social cost, due to some tax evading taxes and so on, it was not reported precisely. So the question is, what is going on here, right? Because that's the topic of the presentation. And first we can refer to the official data. So what police knew about the incidence of abortion, and we can see that this is ridiculously low, and of course we cannot trust this data. So it's good to turn to the data from the hospitals. And if you look at the data from the hospitals, here you have Warsaw and here is Lviv in the 30s, you can see that the abortion ratio, so the number of abortions divided by 1,000 live births, was from 200 to 400. But of course, another thing, the problem of the hospital data is the problem of representativeness, right? The women in the hospitals are selected group because not every woman gave birth in the hospital. And if many of them suffered some health issues because of performing abortions and then ended up as the patient of the hospital, so this number is probably too high. The same applies to the estimation done by Adam Czyżewicz who extrapolated the hospital data for the whole Polish state in the 20s and 30s. But he used the data from the university clinic in Warsaw. He didn't use any kind of weights. He just stated, okay, there are people from the big cities, from the small cities, from the countryside. We don't know the proportion, right? So we can extrapolate that easily. I don't think so, because of course, again, this group is not randomly selected. So we end up with a overestimation. What is consistent in Czyżewicz view is for sure the dynamics. And here we can see that the number of abortion rises steadily from the 20s to the 1930s. So not just to criticize, I present my own estimation. And because, you know, if someone gives you one figure for such a complex situation, you should distrust it. So I propose the intervals for the incidence of abortion in the Second Polish Republic based on the mortality data. And what you can see here, that it ranged from around 100 abortions per 1,000 live births to around 250, so to around 1/4 of live births. So it's much less, it's lower than the hospital data, and it seems reasonable. So, but regarding the period after the war, these are the comparable figures to the 1950s, some round here. This is this a lot? This is, of course, showing the huge prevalence of abortion, because it assumes that around 200,000 or even 300,000 of abortions yearly took place in the 1930s in Poland. So finally, and now we are moving to the microdata. These are the lines that are showing you the level of abortion ratios in this micro studies from the survey of family size. We have Sosnowiec Hospital with very, very high incidence of abortion, more than 500 per 1,000 of births. But when we look at the data, not from the hospital, from Warsaw Ochota, the working class area, it's much less. And if we look at the places like little towns and villages, it's even less. So I think that this approximation is quite fair in this case. So this is the characteristic of the surveys, questionnaires that I have gathered, where the respondents lived. They are concentrated mainly in the urban areas, Warsaw, Sosnowiec, Pabianice, but also we have some more rural or town-like settlements. But most of them live in already low fertility regimes, as you can see from these colors that are depicting general fertility rate. But of course, this is small coverage, but this is the residence. And if we look at the place of birth of the respondent, it gets somehow better, right? Because most of these people were migrants, so they migrated to this urban center from a different places, even of a high or very high fertility. So what is the characteristic of those couples, of those marriages in the survey? 80% of them lived in the urban area, almost 60% were migrants, 91% were Roman Catholics, only 18% of wives of female were active on the labor market outside of the household or agriculture. And concerning the age, this is far from completed fertility career. Mean age is 34 years. Educationally, a quarter of them are illiterate, and only a few, a little margin, have secondary or higher education. In terms of living standards, rather poor situation, more than 4 persons per room, including kitchen. So this is very crowded population. But you can see here the impact of abortion and miscarriage on the fertility, because we have recorded average 5 pregnancies per woman and only 3.7 births per woman. So you can see the amount of reduction. And of course, it's important to ask about the role of contraception and miscarriage and abortion in this reduction. Contraception only was used, or people admitted to use contraception in 14%. And they mainly refer to withdrawal, so almost half of them are referring to withdrawal. As you can see here, this refers to the previous presentation. There was no calendar method listed among these contraceptives. So around 20% of women had at least one miscarriage, and almost 40% of them have experienced induced abortion. So what is the outcome of the statistical modeling of this data, right? Because we can plug this data from the couples, marriages, their children, number of abortion to the statistical model, and look at the determinants of the abortion. So I have run two separate models. One is logistic regression, where you can predict if someone underwent abortion or not. And there is a second model, this is Poisson model, that is predicting additional abortions. So how is it probable that a woman will have additional abortion? So they mainly show the same thing with some few differences. But what I should stress here on different aspects, different characteristics, factors affecting the abortion. And first of all, let me just tell you how we can interpret the results of the regression modeling. So we can make it on example of the woman's age. So this interpretation is as follows. So if all the women in the sample would differ only by age, so they would be exactly equal in terms of being migrant, living in urban area, number of pregnancies, education level, and so on and so forth. So if they differed only by woman's age, then a 1 year of age would lower the probability, the odds, to be precise, of having an abortion. And this reduction is significant. So the older the woman is, the less probable it is that she will have abortion or multiple abortions. So for me, it shows that this is a generational process here. So the older women probably didn't refer to abortion, didn't have to or didn't want to. And the younger women are practicing induced abortion. So regarding the situation that I've mentioned, the migration, it seems quite obvious that migration is reducing social control. So being a migrant is increasing the probability of having an abortion or having additional abortions. Regarding the education, we can see here this gradient that is not in accordance to the abortion culture, because we see that the best educated women have lower chances of having an abortion or having multiple abortions. So this is kind of a Western modern gradient that we are observing here. Next, we have the bargaining power, and here I measured it as the female age at marriage. For example, so if the woman was very young at marriage, it probably doesn't serve as a best example for her position within household or marriage. And we see that it works exactly in that direction. So if the woman was older at marriage, she had higher chances of undergoing the abortion. The same story is with the activity on the labor market. So this is probably due to opportunity costs and due to bargaining power. So if the woman worked, she was more propensous to have the abortion and multiple abortions. And opposite is true for those women who are subordinate or dominated by males. They can have fewer autonomy because the husband is much older than them. The husband is of a higher status than the father of the woman. And finally, the husband is better educated than women. These factors are reducing the probability of having an abortion. So approximate fertility determinants mainly using contraception. We can see that this is typical story for the abortion culture. So there is positive association between contraception and abortion. So it is rather than the last resort, abortion here is equivalent, is one of the equivalent methods of fertility limitation. This is very important. Infant mortality share. So the more children died within this household, in this family, the lower is the probability that these women had abortion once or multiple abortion. So for me, this is indicating potentially the infanticide practices, but it needs to be further researched. Okay, because my time is running up, unfortunately, I am not able to dwell into experience expressed in the narrative sources that I would like very much to do so, but we have to rush to the conclusions. And what I think is the conclusion from this study is that infertility declined as for the 1930s. The abortion was dominant over the contraception means, and the contraceptives were rather traditional. Concerning the abortion culture, it is partially fitting the interwar situation, but this educational gradient is suggesting something contrary. So perhaps this is abortion culture shouldn't be used as a term for this period of time. And maybe this is the story that the abortion in interwar Poland would transform to this Western model of legal, safe, and rare, but it was disrupted during the war and during the communist period. So finally, we see the importance of female autonomy, but we don't really know if this is bargaining mechanism. So the couple agrees that they should have an abortion, or these are the accomplished facts. So the woman is independent enough to go on her own and seek for the abortion. And I think I'm over time, so thank you for this. Thank you.
Maybe you can put some examples in the discussion, I think.
Okay.
So let's move on. We start the discussion after the second presentation. And now I have the pleasure to announce our second speaker, Paweł Kaźmierski. Is a junior member of and scholarship holder at the Gutenberg Graduate School of Humanities and Social Sciences at the Gutenberg University of Mainz. He has graduated in law and at the University in Kraków and is currently finishing his postgraduate. He will speak today about the legal abortion regulations. You see the title, in Soviet occupation zone, German Democratic Republic and the People's Republic of Poland in comparison. So you can talk if you want.
Thank you very much for this friendly introduction. I'm very glad to be here during today's conference, and I think as the majority of all of us, hopefully the next editions of this conference could be organized in the so-called post-pandemic world. I think it's something what the international community is waiting for. I would like to say a few words today. It was have mentioned about abortion regulations, above all in the socialist periods, comparing two socialist countries which not exist anymore, so it's Germany and the People's Republic of Poland. And I think that this comparison should be really interesting for you. Some technical troubles with switching my slides. maybe I will use this not a full video stream. So the plan of the paper and the plan of the presentation is divided into three different parts. In the first part, I would like to say a few words about the evolution of abortion regulations in the People's Republic of Poland, including short historical background. In the second part, I will skip to the abortion regulations in the Soviet occupation zone of Germany and the GDR, including a very short historical overview background. And in the shortest, the third part could be a summary of this presentation. I will compare both legal systems in the socialist period and also try to give a very brief overview of the legal changes which have eliminated these socialist abortion regulations in the early 1990s, which was the end of these regulations so far. So at the beginning of the first part, we can divide the evolution of the abortion regulations in the People's Republic of Poland. Under this term, I will understand the all seizure beginning from 1935 until 1989. And the first period was a period of interwar legal regulations. I will say a few words about that in a while. So it was the years, where the years 1935, 1956. The second one, very important change, came into action with the law on conditions and admissibility of termination of pregnancy. Ustawa o warunkach przerywania ciąży in Polish language version from the 27th April 1956. It was a short period which I'll try to divide between 1956 and 1959, and the new regulations to this law on conditions of admissibility and termination of pregnancy with its social, huge social impacts from December of 1959. It will be the period of legal abortion regulations, People's Republic of Poland 1960, so from January to the end of the communist time. So beginning with the first afterward years till 1956, as a historical background, I could also and only mention as a brief overview the situation of the interwar legal abortion regulations in Poland. As we can understand, the legal culture or law as a part of the cultural heritage. This cultural and this legal heritage in the interwar Poland could be described as using the term of difficult, if not dissonant heritage, because it was very difficult after 123 years of independence to just build a new legal system. And really, in fact, 1980 to 1932, due to the abortion regulations, it was a time of three different completely archaic and very restrictive regulations inherited from the legal system of the practitioners, possession states, so państwa zaborcze in Polish language version. And then came into action after a huge social debates in the end of the 1920s, including Piekło Kobiet, so women's health of Tadeusz Poździelański, which has been mentioned during other presentations at this conference. The new criminal code of 1932, named Makarewicz Code, has got 4 articles related to abortion issues, but it was, in my opinion, still restrictive regarding Article 231. As you can see, a woman, is my translation, so sorry for that, a woman who spends her fetus or allows another person to spend it is punishable by up to 3 years in custody. So it was a very restrictive criminal law, which also penalized not only other persons, or doctors above all, but also women itself for abortion. And it it was in action till 1956, and then came with new social changes, and what I will say in a while, also with the changes above all in the Soviet Union legal system on abortion, law on conditions of admissibility of termination of pregnancy, ustawa o warunkach dopuszczalności przerywania ciąży from 27th April 1956. This act was, the first act was directed, connected directly to the abortion issues, separate from the criminal law. It was a very short legal act, as you can see on the last slide. It is all this act, so half of a page, only 7 articles, and this act has got a Soviet background, because the legal changes which has been made in the Soviet Union, in the Soviet law of abortion from December 1955, has just changed the situation also in Poland after a couple of months. It was a very important change in the legal framework regarding to the abortion regulations. And what was most important, that's which I'll will try to say a few words about it in a while. The doctors decided finally in a kind of let's say admission if the abortion could be legally made. So coming into details of very briefly, this law on conditions of admissibility and termination of pregnancy in the first version from April 1956. Very interesting and very important, the first sentence: in order to protect the health of the women from adverse effects of pregnancy procedures carried out under inappropriate conditions or by persons who are not doctors. It was one of the most important justification of this new law on conditions of termination of pregnancy. So carried out under inappropriate conditions by persons who are not doctors were a lot of such cases in the late 1930s and early 1950s, above all in Poland, a socialist period. And due to this law on termination of pregnancy can only be performed by a doctor if the following are in favor of termination of pregnancy: medical indications, or it was for the first time in the Polish law, difficult living conditions for pregnant women. What does really mean? Of course, was very controversial, and it makes a little more clear a procedure in the first version from this short period 1956-1959. As you can see, it's part of the regulation of Minister of Health, Zarządzenie Ministra Zdrowia on termination of pregnancy from of 11th May. Pursuant to article of the law of 27 April 1956, a pregnant woman who intends to terminate a pregnancy should ask her doctor for a decision on the admissibility of termination of pregnancy. So this admission procedure has to be made. And what is important, what is important, you can see in Article 1, Section 3, if a woman intends to terminate pregnancy due to living conditions, so this is this letter B from the law on termination of pregnancy from April in these regulations, so the woman should make a written statement to the doctor stating these conditions, but not only that until 1959, because in Article 3, Section 1, if a woman intends to terminate the pregnancy on the grounds of living conditions and the veracity of the declarations made by her raises serious doubts. So they often question what, where this raises serious doubts could be asked. Of course, in this situation, the doctor is obliged to determine the exact living conditions of the women. And it's very interesting that, in particular, by conducting direct interviews with representatives of social organizations or by conducting a home interview. These regulations were, I will say, not so perfect in practice. In fact, the new, very important, maybe even more important change came into action in 1959 in December. It was the legal period beginning from January when it came into action with new regulation of Minister of Health of termination of pregnancy. So the same name by completely different meaning. And the most important change in this meaning, in this new regulation of Minister of Health, was the elimination of this doctor's, I will say, not procedure, but admissions. So the admission of checking conditions in which the pregnancy could be terminated. And a woman's statement was enough since that time. It is very, very important change. It has got significant effect of the number of abortions since 1960, early 1960s, in the end of the communist system. And it, of course, increased, I will say and describe it as a social acceptance of abortion procedures. as a result of the change in the law, which has not penalized this abortion so much as earlier. So going to the details very briefly of these new regulations from December 1960, Article 2, Section 2, the doctor on the basis of the examinations carried out, and when it comes to termination of pregnancy due to the difficult living conditions of the women. So this letter B from law on termination of pregnancy from 1956. Also on the basis on her statement, and it was very, very important to the legal practice to this abortion regulations since 1960. In the second part, I would like to briefly say a few words about the evolution of legal abortion in the Soviet Union and GDR. And as a historical background, we could use Strafgesetzbuch, the penal criminal code in Weimar Republic and Third Reich, and then Soviet occupation zone in the first year of the GDR, and it was the base of the 5 separate federal state regulations, and not so liberal, but not so much more restrictive as earlier. Then the law on termination of pregnancy from 1950s as a part of unification of federal state regulations, and a law of 9th, very, very famous, I can see, law on 9th March 1972, and the most liberal period and the biggest social impacts of this law from 1972. So very briefly, abortion regulations in the Weimar Republic and Third Reich has been based on the Strafgesetzbuch from 1971, also to the criminal code of the German Reich, also paragraph 2018, StGB in the form of 1926. It was very restrictive, summarizing a little bit these regulations, and what was in the Third Reich very new, very, I would say, anachronic, if not terrifying. It was that also death penalty or long-term prison could be used as a punishment for abortion, but it was the late war period beginning in the 1933 till the end of the World War II. Legal abortion regulations has been changed in the Soviet occupation zone. Of course, the most important factor of this, because a dramatic situation, a number of sexual offenses committed by the Krasnarmeyce, Soviet soldiers, Red Army and German women in the late war and after war periods, and a number of secret abortions. So I have called it a secret, so unofficial, not legal, illegally abortions, which causing these legal changes in the Soviet occupation zone, which of course was not an independent state at that time. This liberalization, which was in fact not so much liberalization in its meaning of this word, was the base of the federal states level, federal states including Brandenburg, Mecklenburg-Vorpommern, renamed Mecklenburg to the constitutions of Mecklenburg and not Mecklenburg-Vorpommern from January 1937, Saxon, Anhalt, and Thuringen, and very briefly summarizing the restrictive norm of this paragraph 2018 Strafgesetzbuch has been cancelled to these 5 separate regulations. And what was very important and different, for example, to the Polish system, that the prerequisite for the implementation of an abortion was a positive vote of the old commissions, not only of a doctor, but of commission consisting of doctors, socially committed persons, mostly welfare workers, and representatives of the Democratic Women's Association of Germany, DFD, Demokratische Frauenbund Deutschlands. The question was, of course, if this legal change was the liberalization, in fact, due to this implementation of positive vote of the whole commission of so many members of the commissions to make a legal abortion. The next stage, I will say, but not liberalization so far, was Gesetz über den Mutter- und Kinderschutz und die Rechte der Frau, so the law about the mothers and children protection and protection of the women from 27th September 1950. Here you can see a brief translation from German, very interesting first sentence: in the interest of protecting the health of the women, that it should be underlined here, promoting the increase in birth. So promoting the increase in birth should protect mother and childhood and the rights of the women. Very interesting conceptions from 1950, so second year of East Germany. And the abortion was legally only if the child is charged seriously endangers the life of or health of the pregnant woman, or if one of the parents is burdened with serious hereditary disease. So it was for sure not a liberalization of these situations, and it should be underlined also that still the abortion may be carried with the permission of the commission. This commission was composed of doctors, representatives of organs of health, and this DFDs and Democratic Women's League as well. Still, here you can see this little bit legal change since the time of the restrictive criminal law from Weimar or Third Reich. So in the paragraph 153 of Strafgesetzbuch of GDR, the criminal code of East Germany, anyone who interrupts a woman's pregnancy has been punished, could be punished up to 3 years of probation, but it does not mention about women like in criminal code of Poland from 1932. And what was a very, very important legal change, the most important, it was the Gesetz über die Unterbrechung der Schwangerschaft of 9th March 1972. It was, I will say, revolutionary change in abortion regulations in the GDR. It was also interesting that the first law in the history of GDR is a Volkskammer, so a parliament that was not passed anonymously until 1989, and it has implemented a 12 weeks rule and has a huge social impact on the number of abortions in GDR. Coming into details very briefly, this law of termination of pregnancy from 9th March 1972. The first sentence completely different, like this from 1950. Please take a look at that. In order to determine the number, time, and time sequence of births, in addition to the existing possibilities of contraception, the woman is given the right to decide on the interruption of her pregnancy on her own responsibility. So we can see this completely new legal standard, a new legal change here. So own responsibility of the women. And of course, the most important rule was in the section 2 of this first paragraph. The pregnant woman is entitled to have the pregnancy interrupted within 12 weeks after its start by the medical intervention in an obstetric gynecological institution. So there was not so much discussion, and there is no these commissions with DFD members more due to this abortion regulations. Legal regulations. Very short overview at the end. You can see that in the Soviet occupation zone, East Germany and the People's Republic of Poland, we can say about 3 different periods. The most liberal period, so 12 weeks rule, and this period connected to only women's statement, which was enough, for the permission of the doctors for abortion. It was were the years 1972, 1990 in East Germany, and 1960, 1989, so much longer in Poland. And at the end of the presentation, I would like to only say just a few words about comparative analysis of the legal changes in the early 1990s, which had eliminated these socialist period regulations. In Germany, it was a problem connected to the paragraph 2018 Strafgesetzbuch, so a criminal code, which was more restrictive than these regulations, of course, in East Germany, and it was based on Einigungsvertrag, so Unification Act from 31st August 1990, which still leave this legal abortion regulations in former East Germany till for the future. And finally has been unified in the Schwangeren, so-called Schwangeren Familiengesetz, so pregnant women and family law on 27th July 1992. And in Poland, we get a new regulation due this act from 1956 on 13th April 1990, and it was a very important change because, for example, it was introducing permission that the doctor had to try to get a woman to give up an abortion before the abortion. It was a mandatory psychological admission of the woman needed, and also implementing of for the first time doctor conscience clause. And finally, this legal act of termination of abortion was cancelled with a new act of 7 January 1993, and it's a legal act which is still in action till today. I'd like to thank you very much for attention, and apologize for technical troubles, which I shall not show my face through video, and also for extending the time for about 2 minutes. Thank you very much.
Frau Brinkschulte, wir können Sie nicht hören.
So thank you very much to the speakers. I have a question from Johannes to Mr. Ogórek. She asked, she has got the impression that in the 1930s, survey was neglecting of the eastern and northern territories of Poland. You can mention something to this question?
Yes, thank you. So these questionnaires that I have, these are special form of the questionnaire, because whole survey used a questionnaire without the questions about abortion and contraception. And altogether there are around 11,000 questionnaires that I'm now digitizing and putting to the computer. But as you could see, the ones with the question about abortion, contraception are only 500. And then they were sent to various locations, but they never returned. And you know, the organizer of the survey were aware of this, that this is, even though it was anonymous survey, that it's probably hard to capture these processes. So we really don't know about the eastern part of the country, unfortunately.
Mm-hmm. So I have another question, a question for Paweł. First, thank you so much for this comparative view of the legal landscape. Do you have information about how often women or doctors or others were taken to court or penalized?
Thank you very much for this question. To make a brief overview, of course, these legal changes, above all in Poland, has been changed due to the practice of unofficial cases of abortion when we're talking about this 1956. And I have not analyzed very deep in the details the late 1930s and beginning, so early 1950s. So when it's the most restrictive parts, as I could try to show you, this criminal code from 1932, penalizing women as well for abortion. How many courts decisions, how many judgments has been made against women? But I think I'm almost pretty sure that it was absolutely majority, because the number of the abortion which had been made that time, it was one of the most important reason why this legal changes has been made in 1956 and further. Was a huge social problem, above all in such new workers' states, towns like Nowa Huta, for example, by Kraków. And it was a terrifying situation with thousands of such cases which has been made in secret. I don't think that state prosecution was so much interested in penalizing that due to interwar legal criminal law, as we all know, the criminal law of 1930s, late 1930s, which were much more interested in penalizing the political opponents of the system and not women or doctors, which has made abortion that time under this still restrictive regulations. And I think that after 1956, it was not such a case, because the thousands of numbers of this case, which Professor Ogórek also showed in his presentation, was rapidly grown, and I think that was not a case of penalizing so many people at the time. But I haven't, as I have mentioned, I haven't researched that deeply to the current decisions. So this is only a very overall overview, a brief overview of the situation.
So I have another question for Bartosz. It's written, some researchers indicate that there was abortion tourism in the Second Republic from the rural to the urban areas. Does your data reflect this assumption?
Thank you. Yeah, not only abortion tourism, but also the abortion, I don't know, quacks and midwives and abortionists moving from the towns towards the countryside to seek for the clients. So it was not only going to the town or city to perform the abortion. At least that's what is in the literature. But so in my data, I see that being urban dweller or living in an urban area didn't increase the chance of having abortion, but increase the chances of having multiple abortions. So in partially it is adequate to the problem posed in the questions.
Mm-hmm. So also I have a question to Paweł. The historian Dagmar Herzog, has suggested that the legalization of abortion in the GDR in 1922 may have been forced by the campaign of the magazine Stern in spring of 1971, in which many German women made a self-denunciation with the slogan, "I have had an abortion." Has this forced the rapid implementation of free abortion in GDR?
Could you repeat which year you have mentioned at the beginning of your question?
If the movement in the Stern, the self-denunciation of German women, "I have had an abortion," if this has forced the rapid implementation of a free abortion in GDR?
So I think it could be also the case. I'm not pretty sure, and I'm not pretty sure if you will be satisfied with my answer. I haven't just researched so deeply in the details the social impacts and the backgrounds of these legal changes, but so it will be an answer for your question, unfortunately, which I'm not waiting for sure. So
okay, thank you. So I have a second question from Johannes to, I think, Bartosz. The model based on the data from UK from present day, abortion are by now means rare. Might imply in this opinion is made available, accessibly and safe, it will be used? Any thought on it?
Yes, thank you. Yeah, I mean, relatively rare and relatively safe and relatively legal, right? In terms of historical comparison, of course, I might be sloppy on that. I'm not really expert on contemporary abortion trends, but also Europe differs, as you probably know, so maybe closer to this rare, legal and safe is closer to the Netherlands or Scandinavia. I'm not sure if I should be more careful with maybe with this slogan that I used here. Yeah.
Okay. So if there are no more questions to our talkers, then I thank you very much for your presentation. And I announce the fellow presentation, the fellow panel, which will start at 15 and with the title Fertility and Sterilization. So thank you to all to listen to this both very interesting speakers. Thank you.
Thank you very much.
Thank you very much as well.